Hey everyone, thank you so much for joining us for this third session in our Facebook Live series. I'm Dr. Heather Cook. I'm one of the physicians here at Coastal Fertility. Hopefully some of you have had a chance to log into some of our previous sessions, but today I'm very excited to be talking about infertility options and treatment options for our same-sex couples. I think this is one of the first videos or talks we've done on this topic, which I'm very excited about. I really enjoy working with all of our same-sex couples, so I'm excited to kind of share all of the options that exist with you guys. One of the great things about our fertility these days is we have come so far in our treatment options that it has really opened up options for everybody, including our same-sex couples. So we do have a wide variety of options to offer no matter what the situation. I think one really important thing to note before starting is that you absolutely do not need an appointment or, a referral to make an appointment with us. And so if you want to come get some advice or some testing or just to review your treatment options, all you have to do is call our office and our new patient coordinators, or we'll be happy to schedule you for that. So I'm going to kind of jump in to all of our options that we have. We're going to break it down into different topics. First, we're going to kind of focus on our same-sex female couples and go over options in that group of patients. And then we're going to jump into our same-sex male couple options. So with our same-sex female couple options, we have a huge amount of options, really depending on the couple, their desires, their infertility history, really their situation. So we'll walk through all of that. Generally, when we have couples presenting as a same-sex female couple, there is some basic testing that we recommend, and this is kind of overall testing our egg status, making sure that there's no obvious infertility issues, but it's usually not quite as extensive as a full infertility workup if the patient herself does not have any history of infertility in any previous relationships. So that will be tailored to the patient and the couple a little bit as far as the initial testing goes. Again, a lot of that will look at our ovaries, our egg count, some blood work, ultrasound, some basic things like that. We have, as I mentioned, a wide variety of options for our same-sex female couples, starting from very simple options to much more complex options. Some of the options are going to be dictated by the couple and their health history, age, medical history, but a lot of it is just choice of the couple, meaning whose eggs do we want to be using, who wants to be pregnant and carry the pregnancy. Is it just one person going to do both of those things, or do both partners want to participate in each pregnancy? So there are a lot of options really depending on what the couple wants. So our very simplest treatment option, which would really be ideal for patients coming in who want to keep treatment very simple, for somebody that doesn't have infertility, who's having regular cycles and we know that they're ovulating, would be something called a natural cycle with donor sperm intrauterine insemination. What we do for that treatment is really minimize any ultrasounds, blood work, medications, and so we just work with the patient's own menstrual cycle. We would have you buy some home ovulation predictor kits that you start checking at home. These are just cheap over-the-counter kits. When you get a surge telling you that you're going to ovulate the next day, you call us and we will get you in the very next day. And we are here 365 days of the year. It does not matter if it's a weekend or a holiday. When your egg is ready, we are here and we will have somebody available to do your IUI. You would present that day and we would basically take the sample of donor sperm that you had previously selected and place that directly into the uterus for the chance of pregnancy that month. So that's really our simplest option that we have. We can take it up a little bit further, a little bit more aggressive if we need to, if that's not being successful, or if we have somebody who maybe has a lower egg count or, increased age. We can take that up a step and add on medications to that, either oral medications to maybe get somebody ovulating who's not ovulating, or stronger injection medications if we need to basically stimulate more than one egg that cycle. Similar process, you would be taking medications to grow the eggs. We would be monitoring you and timing ovulation so that we can make sure you're coming in on the most optimal day of ovulation to do the IUI. So pregnancy rates with that are really going to depend on the woman's age and kind of what success rates would be in that age group, but that is our way to kind of keep things very simple for couples. Moving on from that, from IUI, we would go into kind of our more advanced fertility treatment options, and this is going to be more in the IVF realm. So this again is going to depend on the couple, their wants, and their medical history. So if we have someone who has some infertility issues where IUI is not going to be an option, we would move to IVF for that patient and basically undergo a kind of a standard IVF process where we're taking that person's eggs and then making embryos with our donor sperm, and those embryos we place back into the same person's uterus to carry the pregnancy. So that would be more akin to kind of a standard IVF cycle. The other really cool option that we have for our same-sex female couples is something that's called co-in vitro fertilization, or sometimes it's called reciprocal in vitro fertilization or reciprocal IVF. And this is a treatment option where we can utilize kind of both partners for the same pregnancy. And this would be a situation where we want to or need to, for whatever reason, use one partner's eggs, and again, want to or need to have the other partner carry the pregnancy. So that would be called co-in vitro fertilization. Very similar to an IVF cycle. We are going to be getting eggs from one partner, inseminating and fertilizing with a donor sperm sample, and then we'd be making embryos to place into the uterus of the other partner, which is a very cool option, and a lot of our couples do elect to go that way. And I have patients kind of doing all of these things, all of the above. We have couples that have had one baby through IUI, had another baby through IVF, had another baby through co-IVF. So really, we have tons of options. I think the other really important thing to put out there is there's a lot of kind of unknown things that go along with these fertility treatment cycles that patients just don't know about. And that's really our goal, is to kind of help guide you through that. For instance, there's specific recommendations when we're using donor sperm where you or your partner should have some infectious disease testing done. There's recommendations for some what's called genetic carrier screening to make sure you're not carriers for any disorders that the sperm donor could also carry. And then really importantly is the legal aspect. I think there's a lot of misinformation out there, and even our same-sex couples who are legally married, we would assume that they would have reproductive rights, both of them equally, to the child that's born from the fertility treatment cycle, but that's not always the case. And so we want to make sure that we're protecting patients, partners, children, and making sure all those things are done properly up front so that there's no issues that arise for our patients later on. So those are the real main points for our same-sex couples using donor sperm. Do we have any questions specifically on that, Holly?
Not seeing any.
Okay. So we will now move on to our same-sex male couple treatment. So obviously this is going to be a little bit different. When we are talking treatment for our same-sex females, we need sperm. That's the part that we're missing, and we're able to utilize donor sperm for that. When we are talking about treatment for our same-sex male couples, we have sperm generally, but now we are needing to get eggs and a uterus, essentially, to make the pregnancy. So when we have our same-sex male couples, coming to us talking about options, the testing for them is also pretty minimal. We generally would want to obviously test the sperm count, which is called a semen analysis. And that can be done for one or both partners, really depending on, are we going to be using one partner's sperm, both partners' sperm. So we would want to just make sure that all of that looks good before starting the process. And then there's also some basic infectious disease blood work and other things that we would recommend before starting. So again, very minimal testing options before starting. And then our next step really is to find an egg source. And so that is something that we do called egg donation, where we recruit and screen young women of childbearing age with good egg quality to essentially donate their eggs. And this most of the time is done anonymously. We can use egg donors who are known to the couple, so friends, family members that want to participate in the process is also an option for couples. And we would essentially put that person through an IVF cycle to retrieve eggs and utilize eggs for our same-sex male couples. We have a very large egg donation program here at Coastal, which is really great for our patients because it gives them a lot of options, a lot of selection on egg donors as far as, where these people are coming from, ethnic background, ultrasound, just a wide variety of options for couples to select from. And we have a very experienced egg donation team specifically that only works on our egg donation cycles, that is really critical for guiding our couples through these more complicated treatment cycles. And so once an egg donor is identified and selected by our same-sex male couple, we would put that person through the treatment and we would have those eggs to utilize for the couple. As I mentioned, we can elect to fertilize the eggs from that egg donation cycle with either one person's sperm or both partners' sperm, depending on what the couple elects to do. We would then grow those out and make embryos in the laboratory, and then at that point is when we need a uterus and somebody to help us carry the pregnancy. And that traditionally was called a surrogate. More commonly, we refer to these women who are helping us as gestational carriers. Again, our third-party reproduction team would help guide couples through this process of working with an agency, usually, to help identify a gestational carrier to help them with carrying the pregnancy. And this is a little bit different than the egg donation process because these women, of course, are not anonymous. They are going to have a relationship through the pregnancy with the couple. The couple is going to be involved in the pregnancy, the OB ultrasound, sometimes the delivery. So we would help guide our couples through that. And of course, there is some complexities to that, meaning with a reproductive lawyer and having contracts drawn up about the relationship and making sure that the gestational carrier is a really good carrier for the couple that's going to give them a healthy pregnancy, healthy baby. So we do all of that, screen the carriers and make sure that this is a good working relationship for everybody involved. Once that happens, the gestational carrier is ready to have the embryo placed into the uterus. Very high pregnancy rates in this situation, usually because we've selected these eggs to be very high quality eggs and very successful for our couples. So I think that wraps up kind of the main points of our male factor couples. Any questions on that, Holly, specifically? Okay. Well, I think that that's the main information I wanted to convey to everybody today. Again, I think take-home points are there's a lot of options available. You do not need a referral from an OBGYN or a doctor to come and see us. We are happy to meet with you in person or over video or phone to go over all of the possible options with you and help to guide you guys through this process. And again, we have a very, very experienced team of nurses and assistants and third-party administrators that are very, very well informed and have done this for a long time to help guide our patients through this really quite effortlessly. So we hope that that was helpful to everybody out there watching, and hopefully we'll be seeing some of you guys in the office. Thank you so much. Talk to you guys soon.